Merci, Monsieur le Président. Ma question est pour...
I have a question for the Premier.
2 weeks after the first news stories told us that over 1,000 patients in Ontario received the wrong dosage of chemotherapy drugs, immense confusion remains. Today, Ontarians still have no reassurance that what occurred in those 4 hospitals could not happen again or is not happening right now. Because while the Minister has dealt with one of the unregulated facilities supplying chemotherapy drugs to our hospital, she cannot even name the others, and they continue to operate without oversight. My question is simple, Premier. After all we've learned this week about how the Health Minister failed Ontarian, does the Premier think that her Health Minister is doing a good job?
Question. Thank you. Premier.
Yes, I do. I do think the Minister of Health is doing a good job, Mr. Speaker. I think the Minister of Health is doing an excellent job. The Minister of Health... That's right. The Minister of Health responded as soon as she knew that there was an issue, Mr. Speaker. She is working to make sure that the expert panel looks at the situation, Mr. Speaker.
Member from Durham will withdraw. And
In place an expert panel, Mr. Speaker, to review the situation. Dr. Jake Thiessen is in place, Mr. Speaker, to make sure that we find out what the issue was, where the systemic issue was, if there is one. And, Mr. Speaker, it is absolutely clear to me that every patient, there's been an attempt, and I think every patient who has been affected has been contacted, Mr. Speaker, so they can see their oncologist.
Supplementary.
Thank you, Mr. Speaker. While we are hearing some excuses as to what this government and her minister, it has become obvious that her minister failed to provide even the most basic of oversight to private, for-profit chemo drug suppliers. We are hearing that everyone else is to blame, but not her ministry. Ontarians are tired of hearing excuses, and they expect the Minister of Health to do her job, to take her responsibility to oversee, to take her responsibility to safeguard our healthcare system seriously. Will the Premier demand that her minister stop passing the buck and admit that what happened was because of the lack of her minister's oversight of those facilities?